this afternoon to join us in this webinar titled Life After the Pandemic, time to focus on our psychological well-being. My name is Sugitha Kanniaseelan. I'm an assistant professor with the Faculty of Business and Technology, University of Cyberjaya, and I will be your moderator for this session. I would like to highlight several housekeeping rules before we get started today. Your microphone is automatically set to mute during the session to avoid any interruption. If you do have any questions during the webinar, do submit them in the Q&A icon that you will see at the bottom of the page. And all the questions will be addressed towards the end of the session. And the slides as well as the recording of today's session will be made available in the SMR website soon after the session. So I am very much honored to introduce to you our presenter of the day, Dr. Rafidah Bahari, Assistant Professor from the Faculty of Medicine, University of Cyberjaya. Now, Dr. Rafidah graduated with MBE BCHBAO from Queen's University of Belfast, and later on she obtained her membership of the Royal College of Psychiatrists, MRC Psych, from Royal College of Psychiatrists in the United Kingdom. Now, in 2018, Dr. Rafidah completed a PhD from Cyberjaya University College of Medical Sciences, now known as University of Cyberjaya, Malaysia, and currently she serves as an assistant professor of psychiatry at the same institution. Having spent most of her medical career in Northern Ireland and Malaysia, Dr. Rafidah has developed a special interest in research in trauma and stress-related disorders, as well as psycho-spiritual interventions. She has written several articles in scientific journals in the above topics and also presented her ideas at both regional and international conferences. At present, Dr. Rafidah is actively involved in research, utilizing both quantitative and qualitative methods. Recently, Dr. Rafidah completed a one-year program in leadership in medicine under the Harvard Medical School of Postgraduate Medical Education. And currently, she's also the Deputy Dean of Academic Affairs at the Faculty of Medicine, University of Cyberjaya. Now, without further ado, let us welcome Dr. Rafidah Bahari to share her presentation with us on life after the pandemic, time to focus on our psychological well-being. The floor is yours, Dr. Rafidah.
Thank you very much, Sugitha, for that kind introduction. I feel nervous now. I'm not worthy for such kindness. Anyway, Assalamualaikum, good morning, good afternoon, and good evening, everyone. I believe we have a global audience today with different time zones. Thank you very much for joining us. And I would also like to thank the organizers for inviting me to speak today. I'm very honored to be here. Although I am an academician, but I'm also very much a clinician. So it's not my intention to make today's talk an academic exercise. I hope what I will share with you will be beneficial at a personal level, which will then be translated to benefit to your organizations and also consequently community at large. Okay, so let me share my slide with you. Okay, great. So let's begin. All right, so I'm just stating the obvious when I say the global pandemic has hit us all hard. It affected everyone from all walks of life, and no country was spared. And because of the pandemic, we had numerous losses. We lost lives. Today I was just checking the statistics, and today there were about 5 million lives lost all over the world because of COVID-19. And a lot of people also lost their jobs and because of that livelihood. Yeah. And similarly, quite a lot of us also lost the lifestyle that we used to have. Most of us at the height of the pandemic were not able to leave our houses. So we have lost, we have missed going out to celebrations, to gatherings, to even places like cinema and concerts and things like that. Yeah. So the pandemic has changed the way we work. I'm sure a lot of you can empathize with the mother in the picture. The way we study and teach, and also basically the way we live. Everywhere you go, you have to wear your mask, you have to keep your social distance, and you have to scan your temperature. So it changed basically our lives. And the effects of the pandemic was beyond just the physical. Apart from the losses earlier that I mentioned earlier, there are also psychological effects. The news have covered different stories about psychological effects. There are effects on students' mental health, effects on parents, frontliners, and generally, adults, or just everyone. Yeah. So there are when there is an event like this, a very distressing event, there are also psychological effects, not just the physical. Okay. So the pandemic started in January 2020, and now we are in December, nearly December 2021. So are we seeing the end of the pandemic? At the beginning, when we had rapid vaccine rollout, we saw a flattening of the curve, and we thought, that's the transition. There's a transition towards normalcy, and we felt that when we achieve herd immunity, then that's it. That will be the end of the pandemic. However, since then, there were new variants and there were surges or waves in the pandemic. So in Malaysia, we're talking about maybe, are we facing the next wave? So when will it end? Yeah. Now, we think the more realistic endpoint would be when, although the COVID-19 is still here, the burden can be controlled, meaning that countries can manage COVID-19 as endemic disease. Yeah. In the meantime, while the disease is being controlled, what we have to do is continue to be vigilant. But it's also time for us to focus on our psychological well-being. This is the time. So when the pandemic ends, we will emerge better and stronger. Right. So before we can talk about, before we delve deeper into psychological well-being, what is it? We have to understand what is meant by psychological well-being, or some people call it also emotional well-being. Yeah? So before that, we have to talk about health. WHO, in its definition, states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, or meaning illness. Yeah. So to be healthy, it means that you have to be physically, mentally, and socially healthy. Yeah. And not just not have any signs or symptoms of disease. Right. Wellness is the optimal state of health of individuals and groups. Yeah. WHO, or just to summarize it, living positively. So what about psychological well-being? There's a lot of definition. Maybe some of you are familiar with Carol Riff's 6-factor model of psychological well-being. There are other models of psychological well-being, but I like to use this definition by Hupert, who says it is a combination of feeling good and functioning effectively. Basically, living well. Yeah, we are able to function and achieve not just function, but function effectively, achieve our goals, in life, and also feel good while doing it. So why is psychological well-being important? Studies shows that people with higher psychological well-being will achieve, they will live longer, they are basically healthier, they have better quality of life, they are less likely to be involved in substances or crimes, they earn more, and they display more pro-social behavior, meaning they volunteer more, help other people more. Okay, so how do we improve our psychological well-being? Now we know that it is important to have a good psychological well-being. So in the next part, I will share with you some suggestions to improve your psychological well-being. These are what most people found useful. However, there are other ways that I do not have the time to share. So I hope what I share with you today will be useful, and maybe you have some more ideas. Maybe we'll give you some more ideas on how to improve your psychological well-being. Right? So first of all, being grateful. Basically, this is a key to having a good psychological well-being. So how do you practice being grateful? You need to practice being grateful every day. What you can do, my suggestion is usually to my patients in the psychiatric clinic, I would say first thing in the morning or last thing at night. Think of one thing that you are grateful for. You don't need to do it. You don't need to think of, you don't need to have a long list. Just think of one thing that you are grateful for. For example, now I'm grateful that it's not raining because if it rains, then our internet will be disrupted. So at least it's a nice sunny day here in Malaysia. Okay, so the next one, incorporate relaxation into your day. I'm not just saying for you to relax every day. I'm saying that you incorporate it into your day. Make it a habit. Practice it daily. There are many ways to relax, and you have to find the best for you. Most people find breathing exercise useful. Yeah, if you can see in the cartoon, the person is doing breathing exercise. She's breathing in through the nose and exhaling through the mouth. Yeah. So breathing exercise is really useful. Again, I would advise my patients to do this daily, maybe twice a day, and to make it easy for them to become a habit, you can couple it with something that you do every day. For example, for Muslims, we pray the morning prayer every day in the morning. So after the morning prayer, when they sit down, just at the end of it, when they just finish, then they can sit down and do breathing exercise for a couple of minutes. Yeah? The next one is exercise. I don't need to labor on this point because I think all of you are aware there's a lot of studies proving that exercise is good for mental health as a whole, and it can also help to relax. The third one would be visualization. In this case, you can sit and think about either a place you've been to, or maybe somewhere you've seen in the television or in a picture, and imagine that you are there at the place, and you can visualize what it feels like, how you feel. Is it hot? Is it cold? What can you see? What can you hear? What can you smell? So visualize all that. So that will help you. Yeah. And then next, you can practice your hobbies. Yeah, you can do gardening if you like, reading, playing with your pets and things like that, or doing arts and crafts or whatever you are interested in. The main thing is it makes you happy. Yeah. And my last recommendation is you can also use spiritual approaches, such as performing prayers, and reading holy books like the Quran. Yeah? And as I mentioned, there are others. Relaxation is useful because we spend our days worrying, overthinking. When we do that, worrying is actually tiring. People don't realize this. Worrying is tiring. So you need breaks in your day to not think about it. Yeah. So that's why you need to incorporate time to relax. So time that you don't worry about these things, your whatever problems you have. So you need to incorporate periods of relaxations into your day. Okay. The next one is being kind. Basically, giving people gifts, presents, time, money, etc., and showing kindness. Yeah, when you do that, it doesn't just make the person receiving happier. It also makes the person giving happier. And generally, when kindness is being shown, people tend to think more positively because it shows, you have the power to make the world a nicer place to live in. Everyone have that power. You don't have to give a lot of money. You don't have to spend a lot of time. Maybe just doing little things. And again, you can incorporate it into your life. Look for ways to be kind. And when you do that, it can become a habit. The next one would be connecting with others. As we know, as you all know, humans are social beings, and loneliness can cause mental health issues. I think you've seen this in the pandemic, especially when there are people who are living alone. Yeah, before the pandemic, even though they live alone, they would go out, meet their friends, at least go to work. Yeah, but because of the pandemic, a lot of people who are living alone, who are single, living alone, felt very lonely because they are separated from others. Yeah, you can't actually go and physically meet other people. All you can do is meet online. Yeah, this is especially important when people have been in quarantine. Yeah, and studies have been done on people who have been in quarantine and they felt lonely, which will then progress into disorders like depression and anxiety. When we talk about connection with other people, what is important is not the number of people we are connecting with. It's the deep connection. Having fewer people who you connect deeply is more important than having a lot of people who you connect just superficially. Yeah, so it's not the number of friends you have on Facebook or followers you have on Instagram. Yeah, but it's the people who you really connect deeply. Yeah, and physical meeting is superior. Yeah, when we have meetings like this, there are things we can miss. The small non-verbal clues that we can miss. That although it's okay, it's less makes the meeting less superior. Yeah, so physical meeting is always better. And when you connect with others, when you have a lot of friends, a lot of acquaintances and things like that, and you connect with them deeply, these people will form your support system. And a strong support system is extremely in mental health. Yeah, in most cases, having good support system can protect from having mental illness. And if they do have mental illness, it can differentiate between a good outcome and a bad outcome. Not so much the severity of the condition, or not severity, sorry, not so much the types of condition, but the support system is most important in the outcome of mental illness, sorry. Okay, so the next one would be finding a purpose in life. I think this is quite obvious that if a life is lived in, if you live a purposeful and meaningful life, you feel generally happier. Yeah, so it is vital for psychological well-being. Your life's purpose does not have to be earth-shattering. Yeah, it can be small, as long it is meaningful to you. Yeah, so if you at this point are not sure what is your purpose in life, yeah, so you ask this question: what legacy are you leaving behind? So when you think about your legacy, then that is your purpose. So find your purpose in life and you will feel much happier. The next one is probably easier said than done, yeah, but it's very important that you forgive yourself and forgive others. When you forgive, you let go of anger, because when you have this, you keep this hurt, yeah, you continue to feel angry, you continue to feel um, the pain. Yeah. So if you forgive, you let go of anger. You free yourself from your past hurt. And when you can free yourself, you have more time to and energy to be put into doing positive things. And finally, this is the last recommendation that I have, is practice self-reflection. Yeah? Just, every day, think about, what are your strengths? What are your weaknesses? What are the things that go well? What are the things that don't go well? Yeah? And be aware of what you're thinking, what you're feeling, and what your actions are. Yeah? So whatever interaction you're having, think about, what am I thinking? What am I feeling? Why am I acting this way? Yeah? So having self-reflection or practicing self-reflection can help you to detect, among others, can help you to detect warning signs of mental health issues, and also can help you to manage them early. Yeah. So if you are aware that you have signs of poor psychological well-being, then you can manage them early, and that usually translates to better prognosis or better outcome. Yeah, it's quite funny in the past when I do talks, especially talk about stress. Yeah, so when I ask the audience, is anyone stressed? Has anyone experienced stress? Yeah, so no one would want to answer that, but stress is something that everyone experiences, and in fact, if you don't experience stress, you are not alive. So any living creature will experience stress at, at or at some point of their life. Okay, just before before I finish, I just want to talk to you about signs that your psychological well-being is at risk. So we want to have good psychological well-being, and we saw earlier that having good psychological well-being will improve, will make us live longer, feel happier, protect us from abusing substances and things like that. But sometimes just sometimes life can be difficult. Yeah, so we can be affected, and our psychological well-being may be at risk. So we do need to notice the signs that it is, we're not doing so well. Yeah, and we need to get help early. Yeah, if possible, get help from mental health professionals. Okay, so these are the signs that you need to look out for. First of all, worrying more than usual, either more frequently, or worrying about small, even small things, yeah, excessively, yeah. So either more frequently or more excessively. Okay. Secondly, getting angry easily or irritable, yeah. So this is one of the signs also. Next, feeling hopeless, worthless, or guilty, even though there's no reason for feeling guilty. Yeah. Next, sad, feeling sad all the time. So usually the uh, when we make a diagnosis of depression, the person we ask the person if they feel sad all the time. So, and the feeling of sadness is not just intermittent. It's not just at certain times because something happened. It must be most of the time, at least for 2 weeks. Yeah, so that will be worrying. But if you feel sad because something happened, but only for maybe half an hour or so, that's not worrying. That's just normal. Okay. The next one will be using substances. Yeah. If you see the picture, maybe smoking cigarettes more. Yeah. The next would be disruption, either sleeping too much or sleeping too little, or having more appetite or less appetite. Yeah, so increase or decrease appetite and increase or decrease sleep. Yeah. The next sign is isolating self, preferring to be alone. So this is quite a common sign that you see, that I see in clinical practice even. Yeah. Next is deterioration in work performance. Most people say when they worry too much, they find it difficult to concentrate with their work. Yeah, hence they forget more and they find it difficult to finish or to complete their tasks. Yeah, so they have a deterioration in work performance and thinking of harming self or others. So that the last one is really a red flag. Yeah, if there is that, you really need to see to consult a mental health professional. All right. So before we finish, I don't really like to talk for long. I prefer to have a lot of questions so that we can interact. So so that's why it's quite a short talk. But I hope there are some questions later. But before I finish, these are the things that I would like you to take home with you. Yeah. First of all, from this talk, I hope you realize that the effect of the pandemic is it's not just the physical. It went beyond that. Yeah, there are also psychological effects. And hopefully we are now emerging from the pandemic. So this is the best time for us to look after ourselves. Yeah? I have presented to you some suggestions how for you to look after yourselves, namely maybe practicing relaxation daily, being kind, connecting with others, and etc. And finally, if there are signs of psychological well-being at risk, yeah, if you see those warning signs in yourself, don't be ashamed. Yeah, please get help. Yeah, there's nothing to be ashamed of. Yeah, mental illness is the same as any other illness. Yeah, there are biological basis for them. Don't be ashamed. Get help. Yeah, consult a mental health professional immediately. All right. So just before I finish, just a final message. Take care of yourselves and take care of each other and stay safe. So that's it. Thank you very much, everyone, for your attention.
Thank you very much, Dr. Rafidah, for such a great sharing on your part. I myself resonated with quite a number of things that you did share earlier. Now, we have quite a number of questions coming in. So allow me to read the first question out to you from Mr. Kumaran Raman. Prof. Rafidah, is psychological well-being linked to the consumption of fruit and vegetables?
Okay, uh, very good question. Not a very easy one to answer. Okay, it's in a way it is related. Maybe not directly related, but it is related. Okay, why I say that is because when we are stressed, yeah, or when we are our psychological well-being is at risk, yeah, there are changes in the brain that can also translate to behavioral changes or and also translate to cognitive changes in which it affects how we judge. Yeah, it affects our judgment. Okay, so things like wanting to exercise, consuming fruits and vegetables, those are um, good judgments. Yeah, so those are things that we know good for ourselves. Yeah, but sometimes when our psychological well-being is at risk, we tend to make poor judgments. So we tend to use substances and not eat as well as probably when we would have done if we are psychologically healthy. Yeah. The other thing is when we are stressed, for example, there are also changes in the brain and in the body that influence you to want to eat things with high sugar and high fat content. Yeah. Sometimes this is psychologically related. Yeah, especially if you find these food comforting. Yeah, but there's also biological basis in which when you are in those situations, you do want to eat high sugar and high fat food. So I hope that's that answered your question. Yeah, so not directly, but there is an indirect relationship there.
All right, okay. So the next question, this is for healthcare service providers, mental healthcare service providers. Now, this pandemic has had a huge impact on the mental health of people. And from your view, Dr. Rafidah, which area of mental healthcare service providers should focus on in deciding their offerings in the future?
Okay. Again, excellent question. I like this question because I feel that we should not just think about treating psychiatric conditions or mental illness. We also have to move towards preventive psychiatry. Yeah? Preventive psychiatry is not something new. In fact, it has been, described maybe in the 60s or 70s or something like that. Yeah, so it has been described a long time ago, but it's not so. We're not really emphasizing on it. Yeah. So what it means by preventive psychiatry is preventing people from getting the illness in the first place. Yeah. So I think that's why that's why I'm bringing this topic. Yeah, something like this happened, pandemic, and it hits people hard. Yeah, but it doesn't mean when something like this happen, you will be psychologically affected. It does not mean that. Yeah, if you can do what I've suggested or other things. Yeah, if you can manage your psychological well-being, you may not um, get mental illness, you may not develop mental illness, but what will happen is that you will emerge better and stronger. Yeah, you will be more resilient. Okay, so if you ask me, I think the focus should be more on preventive psychiatry, not just maybe adults or children and things like that. But I think as a whole, probably we should focus more on preventive psychiatry. Okay. So I hope that answers your question.
That's a good answer, Dr. Rafidah. Thank you. Now, next question is, I like this question very much. Could you share tips to be positively resilient in the post-pandemic time?
Okay, yes, excellent. To be resilient is you actually need to learn to be resilient. Yeah, being resilient is not just something that you're not really. Maybe certain people have the tendency and things like that, but usually resilient develops following what you experience. Yeah. So whenever you experience something like the pandemic, something, an event that is really really distressing, really difficult. Yeah. How you develop resilience is by learning how to learning to cope with it. Yeah. Learning how to manage it. Yeah. So to me, if some people face certain events which are distressing and they develop mental illness, it's not a weakness, because it gives them a chance to learn from it. And when they recover from it, they are better people. And hopefully what they have learned will protect them from getting mental illness again in the future. So that's resilient. Yeah, so that's resilience. So you develop resilience. So whatever you learn, whatever you face, you learn how to cope with that. And so that next time you don't succumb to the same condition again.
All right, thank you, Doctor. Next question. Now, the biggest issue, and probably rather subdued, is that children have been facing a lot of difficulty in expressing themselves. They can't really do that with their parents as they can be with their peers or friends. So what can be done about this?
Oh, this is a really difficult question. Yeah, especially now. Yeah, because during the pandemic, children, when they go to school, it's not just they are learning the contents. They're not just learning to read, to write, to do all that. They are also learning social skills. They are also learning how to interact with friends, how to say things to people in a good way, how to say no in a good way, and things like that. So they are learning to do that. Unfortunately, during the pandemic, schools were moved online, so children have no longer interactions. So this, I think, is a problem. And I think Priya, you identified this is a problem. Okay, so all I can say is at this point, hopefully when as parents, I think you will have to try and treat the children according to their level. Okay, so if they are young, treat them as children. But you also you need to bring your language down. You can't really use big words and things like that. And have play times with them. Spend time and have and play with them, things like that. And then when they are older, talk to them like you are their friend. So I think if you can develop that relationship while they are young, so you have a good bonding when they are young, when they are children, they are small children, and then continue that bonding. And whenever they are a bit older, talk to them as you are their friend. So then it is easier for them to express themselves to you. So I think that's all we can do at this time. Hopefully when schools are open for much longer and things like that, hopefully things get back to normal and children can mix around with their peers a bit more, and hopefully we hope that this is not a lasting effect.
Right, good. Thank you, Doctor. Now, the next question is very much related to the workplace. how do we identify team members who are not psychologically well, and how do we help them?
Yeah. Again, good question. Yeah, I think I've presented some warning signs earlier. Yeah. So apart from looking out for these signs in yourself, you can also look out for these signs in your colleagues, in your friends. Yeah. I think looking for them is probably not the difficult thing. Difficult thing is approaching them and telling them you are worried about their mental health. I think that's the more difficult question.
That's true. That's true. Okay, so this is quite an interesting question. The increase in anxiety and depression, is it more in male or female students, and why?
Okay. Yeah. I don't have the figures on top of my head. We did a study. We did a few studies actually about anxiety and depression during the pandemic. I think, if I'm not mistaken, usually anxiety and depression affects more female. Yeah, that's it's not really surprising, because that is usually the social demographics that affects females, if affects females anyway. Yeah. So usually anxiety and depression do affect females more, but males are more affected. um, Males are also affected, but the picture is different. Yeah. They tend to be to abuse substances more and things like that.
Okay, now I have the next question is, how do you tame an overactive mind?
Okay. Excellent question. Right. How do you tame an overactive mind? Yeah. I mentioned just now, worrying is tiring. Yeah. Overthinking, thinking all the time, it is worrying. Yeah. What I personally find useful is to have time, to incorporate time to relax. Yeah, so I mentioned earlier. So for example, visualization. Yeah, so whenever you visualize, your mind is not thinking or not worrying. Yeah, but you are concentrating it. You can't just tell yourself, don't think about it. Yeah, it's like an elephant in the room. Don't think about the elephant in the room. You will definitely think about it. Yeah, it's not as easy as that, but you have to distract your mind. Yeah, distract your mind by doing things that you enjoy. Distract your mind by doing things that you like. You should incorporate this. Yeah. There are distraction techniques that people can use. Yeah. For example, some people use crossword puzzles, Sudoku, and things like that, so that they focus, instead of worrying. Yeah, they focus on those tasks. Or my personal favorite, reading storybooks. Yeah, I love reading storybooks. So you actually, so you forget about what's worrying you, and you're focusing on the story. Yeah. So to tame it, you do have to train it. Yeah. So it means that you need to incorporate it in your daily life. So you have to have sessions like this. Yeah. And Mr. Ramli, I assume you're a Muslim. So for Muslims, when you do your prayers, the other way to tame an overactive mind is, whenever you do your prayers, you concentrate, on your word, whatever you're reading during your prayers. Yeah? And that can also help to to tame this overactive mind.
Right, that's a great answer, Doctor. Now, another question from Mr. Ramli. Now, I have read somewhere that one needs to be in the present rather than be in the past or future, which can trigger anxiety and affect mental health, mental well-being. But sometimes it is easier said than done, right? And are there any techniques that can be leveraged to make one be in the present?
Okay. I think it's related to what I mentioned just now. Yeah. In if you talk about techniques, to be in the present, it's related to what I mentioned just now. In psychology or psychiatry, we use something called mindfulness. Yeah, mindfulness is, I think, is something that is taken from the Hinduism or Buddhism. Yeah, which is, you have periods of time where you just, not think of anything else, but think about being in the present. Yeah. So, when you do that, what we mean by being in the present is just when you have this, you are in those sessions, don't think about anything else, but just be aware. Yeah, be aware of, what's going on around you. Even if you are sitting, what do you feel underneath you? Yeah, so just concentrate on that. Yeah, again, it's related also, as I mentioned, as a Muslim, right? When you are praying, yeah, and you are being khusyuk, that's the term we use, that's also, be in the present. Yeah, the problem about worrying about the past is, it overcomes you and you can't change anything. Yeah, and also, if you worry too much about the future, if it's going to turn out badly, it will turn out badly. Yeah, so there's no point worrying about it too much anyway. Yeah, so have these periods of mindfulness, Mr. Ramli, where you just think about, now. Yeah.
All right. Next question. Prof, are there any preventive measures to be taken on this to curb the psychological well-being of humans? Now, this is especially now that we are living differently in a digital age where we have to manage a truly unforgiving environment. What kind of preventive measures can we take?
Yeah. It's a difficult one.
Yes, it is.
Yeah. I don't think there's any shortcuts. There's no short answers. There's no short way of doing it, or there's no simple way of doing it. It's just that, again, going back to, um, being aware, yeah, reflecting, being aware of what's going on in our mind, in our emotions, yeah, in our action, what's going on in there. Yeah, also practicing, just what I mentioned earlier, those relaxation, being grateful and things like that. In terms of technology, you are right. Some the use of certain technologies, while they makes things easier, they are also they also um, uh, contributes towards the worsening of psychological well-being. Yeah, for example, emails, yeah, and WhatsApp. They are very good, they're very useful, they're very handy, convenient, but they are also, they're also disruptive. Yeah, for example, if I read WhatsApp at night, I will tend to worry about it. I would think about, how am I going to answer this? Or even emails, how am I going to answer this? So as a result, I won't be able to sleep. Yeah? That has happened to me many times in the past. So now I have to try and be more disciplined. So after 10 o'clock at night, I'm sorry, I won't be able to answer emails or WhatsApp, yeah, for my own mental health, so that I can get a good night's sleep. I will have to not answer your emails. So technology is very good, but we also need to have a bit of boundary. Yeah, we have to know when to use it and when not to use it. Yeah, also when we are maybe on the at the dinner table. Yeah, so hopefully we can everyone can put their phones away and have a chat, talk to each other. Yeah, that are some ways you can do to minimize disruption from technology, and hopefully help improve your psychological well-being.
That is true. That is true. Thank you. One last question, which is a very cute question, I would say. So, you mentioned fruit and vegetables. I love lamb shank, Cik Khairuddin, yeah. Does that mean I have a mental health problem?
I can't, unfortunately, I need 1 hour with you to be able to tell you whether you have mental health problem. Just that by telling me that you love lamb shank, it's impossible for me to say whether you do or not. But, just loving lamb shank or liking to have, I do eat junk food sometimes. It's not, you can, it's just about making good choices. Yeah. So you can have lamb shanks or things you like, but hopefully most of the time eat well, eat good food. Yeah. Okay, thank you very much for that question.
All right. So I think in summary, what I've gathered from this talk is that it is so important to inculcate the right daily habits. I think as part of our daily routine, what we do to inculcate better mental health, like how we brush our teeth or how we do our prayers, we've got to do one or two things that will actually ultimately take us towards enjoying a better mental health, right? I think that's the one key takeaway that I myself have gathered from this sharing of yours. Thank you so much, Dr. Rafidah, for this wonderful sharing from your part. I think there are no more questions to be asked. Now, I would like to end this session by sharing a quote. So this quote here says, give yourself the same care and attention that you give to others and watch yourself bloom. So I think that's something we often don't do, that we always care about others, people we love, our children, our spouses, our family, parents, but sometimes we don't give ourselves enough. So self-love is perhaps one of the most important things to practice in the present day and in the future too. I guess that's about it from all of us. Thank you, Dr. Rafidah. Thank you, Vinesh.
Thank you. Thank you very much for this opportunity, and thank you for all the questions.
Thank you to University of Cyberjaya and Asma Group for creating this opportunity for us to hear Dr. Rafidah out and for us to learn so much about mental health, even in this 1 hour. Thank you very much.